For more on the Ebola epidemic and the worldwide effort to contain it, I'm joined by Stephen Morrison. He's a global health policy expert, Senior Vice President and Director of Global Health Policy at the Center for Strategic and International Studies. Stephen, thanks for being on the program with us. So let's begin with Nigeria. The country has officially declared the country is Ebola-free. And we saw in Jim Spellman's piece, the key seems to be act fast and act aggressively. What exactly did Nigeria do that other countries in West Africa, Guinea, Sierra Leone, and Liberia, can learn from Nigeria?
Well, the Nigerians had capacity. The countries, Liberia, Sierra Leone, Guinea, did not have the basic capacities to detect, to confirm the presence, and to respond quickly. The Nigerians had this, and when the Patrick Sawyer case was introduced, when he flew to Lagos, he was very sick, he died, he infected quite a number of people. There were secondary transmissions that involved going to Fort Harcourt. An alarm went off, and the governor of Lagos—
they tackled it immediately.
Intervened. They mobilized their own Abu deal with polio. This is a very important fact, is that they had this experience in dealing with polio outbreaks, in having an emergency operations center with the capacity to collect data, to confirm, to respond, to put campaigns together. They moved that team down to Lagos, put it in place. They brought in a number of their other experts, and they welcomed in 10 to 15 CDC experts who worked with them, and they were able to do the contact tracing. They did over 1,000 people, over 19,000 calls and contacts to chase down all those people who had had some contact with Patrick Sawyer, or those people who became infected. I believe it was 19 that were infected by him.
So at this point, are there lessons Guinea, Sierra Leone, and Liberia can learn from Nigeria moving forward at this stage of the game, or is it too late for them?
Well, things are pretty far out of control in those three countries. Right now you have an exponential growth of the epidemic. It's the numbers that are being infected and the numbers that are dying are doubling every 20 days. It's overwhelming the existing systems. So we're in a situation where a more deliberate campaign of intervening and isolating and containing and doing contact tracing becomes very, very difficult. So what is happening now is a military-style operation is being launched into that setting, led by the US into Liberia, by the British into Sierra Leone, to create treatment centers and to put in place community outreach programs on a crash basis. Over time, I think the lesson that these countries will learn is that they have to create and support and sustain basic health capacities. That's a huge vulnerability. When something like Ebola gets introduced, it's not even, the cases are not even confirmed for 4 months. People don't trust their government. People don't trust the capacities of their health system, and the epidemic is driven underground. And now it got far out ahead of us.
So Stephen, what do you think of the US response so far? And certainly it seems like even the United States can learn lessons from Nigeria in this case.
Well, the US have responded in a very bold and ambitious way. Everyone was late to acknowledge this problem that really began to gallop in the early summer. It wasn't until the end of summer and into September that there was a great awakening. President Obama made a commitment on September 16th to deploy now upwards of 4,000 US troops, $1 billion of support, a combination of military and civilian support. This is a huge mobilization by the United States, principally focused upon Liberia. And that has helped, we hope, to galvanize others. One of the biggest problems is to make sure that we're not alone in this. The British have come in a dramatic way, as you pointed out. The Chinese and the Cubans are doing very interesting things. The Europeans are getting more engaged.
So I'm just curious about Ron Klain, the man who has been tapped as the Obama administration's Ebola czar. He apparently starts on the job this week.
Yes.
In your opinion, what should be his first priority? And is this too little, too late?
I wouldn't jump to that conclusion. I mean, Ron Klain, the push to appoint him was really driven by events that happened here at home, less with what was happening in the U.S. mobilization in West Africa. This was more about the missteps in Dallas and when Thomas Eric Duncan was introduced, there were a series of missteps. Then we had two secondary infections of the nurses. There were some very hard lessons learned, and we discovered how swiftly fear and panic could spread across the nation from 3 cases, really, here. And so the public trust and confidence was beginning to diminish. We're in the middle of our own electoral cycle, which feeds this as well. So Klain was appointed in order to bring high-level political coordination and leadership.
And confidence, perhaps.
And to restore public confidence and push back on fear and to get our system into a tighter form of coordination. You've already seen yesterday the Pentagon announced the creation of a 30-person military medical unit that can be deployed out anywhere in the country to assist if there are other outbreaks. CDC has taken a very similar step. The protocols for the use of the protective equipment have been tightened up. A number of things have been improved, and I think looking forward, I think that those hard lessons were not for nothing. They actually have translated in short order into some very important adjustments.
Stephen Morrison, thank you so much, sir.
Thank you.